All right, we are looking at part 7 of our series here on hydrotherapy, theory and practice. We'll be getting to the practice here in a little while, but just a reminder that it's always important to not blindly accept any therapy, treatment, or modality without doing your due diligence to find out if it's what actually works best for you. And the information here is just another tool to put in your toolbox, a quiver or arrow in your quiver, ways to take care of medical intervention that may not be ways that you've used before, but are very effective. In fact, back in 1903, Thomas Edison is noted as having stated that the doctor of the future won't be giving medicine, but will be instructing his patients in the care of their bodies and what they eat, and in the prevention and causes of disease. And even before that, in 1885, God's messenger Ellen White mentioned in Testimonies for the Church that there's only one way that heaven approves, and that's God's remedies, those of nature. So that's the powerful properties of pure air, water, cleanliness, a proper diet, and purity of life, as well as a trust in God. But many people have lost their skill in working with these modalities, and it just takes some time to redevelop that and implement sometimes. And that time of implementation is something that in our society that we are just instant gratification is the name of the game. We want to see results the next moment after we've started something. And that's only available in a strictly pharmaceutical approach. And even that sometimes comes with its baggage. It always comes with its baggage. It's costly both on the pocketbook as well as on the body. In 3 John 1 verse 2, we need to make sure that we take care of our soul as well, that you prosper and be in health just as your soul prospers. And Paul in Romans 12, 1 and 2, we want to be able to not be conformed to the world, but transformed by the renewing of our mind, because that's an acceptable and perfect will of God. That's a pretty strong statement there, the perfect will of God. And we want to be able to present our bodies as a living sacrifice. And a holy living sacrifice. So when we're looking at hydrotherapy, there are some components of high-level care, sometimes in the realm of kind of the nursing kind of thought processing, just some things that you want to take into consideration as you begin working with and as you are a warm, draft-free room so that there isn't any possibility of being chilled. You want to keep the bright lights to a minimum or absent, just some nice, you don't want it to be dark, but you want it to have nothing glaring that would be kind of shocking to the system. And one way to take care of that is to also just thinking about it, you can explain the procedure. It's always helpful to have the patient know, not necessarily detail, but just have an idea what you're doing so that they don't end up being surprised. And always be available during the treatment, either right there by the side or just immediately close by while you're doing the treatment process so that you can keep ready for any changes, monitor them, any requests that might be made during that period of time. Just make sure that you let them know what you're going to be doing and also what you expect to happen as a result. What kind of a reaction they may be having, whether it's warming or cooling, those kind of things, so they know what to expect. And then just keep an eye on them, study them, make sure you're noting any changes that occur, and make sure, again, planning ahead helps you to change the packs efficiently. That is the cold packs and heat packs. However, you're implementing the circulation changes. Also, make sure that you're taking care of the area where you're working in. If you're in a person's home or in your own home, just cover bedding and furniture, etc. If you're using water therapy, so that you don't get damage occurring from the treatment process. And then other distracting noises like a TV or a radio or an overly talkative person who's asking too many questions, for example. Just kind of minimize that extraneous activity that's going on, just to help to further the person's ability to get the most out of the treatment that you're doing. And one thing that's not noted here so much, but also you want to make sure that as you begin treatment and end treatment, that you just ask if you can have a word of prayer with them, because this is one of God's modalities for care, and just want to ask his blessing on that too. And one of the neat things about doing hydrotherapy is the time it takes, because even though you're not necessarily carrying on a long conversation, it gives you the opportunity to speak to them and talk to them in a caring way. And while you're helping them, you may be able to also help them with their spiritual needs as well. So keep a positive outlook while you're talking to them. Be cheerful. Excess talking is wearisome to the person who is being waited upon. Proverbs 17:22 is a powerful reminder that a merry heart doeth good like a medicine, but a broken spirit dries up the bones. And what breaks the spirit? Well, there can be lots of different things. Guilt can break a spirit. That's a huge one. Other types of sadness can break a spirit, a loss of hope of being well again. But if you can have a cheerful attitude and a positive outlook with the treatments, that can go a long way to giving the person you're helping confidence as well. So be hopeful, pray with them, and direct them to God for courage and strength throughout the course of the treatment process. Psalm 46:1 says, God is our refuge and strength, a very present help in trouble. Something to remember. And, it's so often that we go to God in trouble. Why don't we go to God just every day? We're told to pray without ceasing, and basically prayer is a conversation with God, and most of the time it seems like it comes up in times of dire need or some need of some kind, but we can also talk to him about our joys and the good things in life too. And we just need to remember that we can talk to him as a friend that he desires to be. So the focus again is helping the individual. So they must be warm before treatment begins. So sometimes that actually requires warming them first. You don't just go directly into a treatment without having them pre-warmed. So that can be a shower, it could be a warm bath, it could be some heating blankets or fomentations. Remember we talked about how the referred heating of the feet can give the whole body a sensation of warmth that it may not necessarily have on its own. So a cold compress to the neck or head when you're using a heating application, just to make sure that the head doesn't overheat. The body itself can take a higher temperature than the head, because the neurological tissue of the brain is much more sensitive to heat stress and denaturing of proteins than muscle tissue and other organ level tissues. So you want to make sure that the head area is kept properly cooled. So don't expose more area than needed, just the area that you're treating. So if you're just doing a limb, you don't want to have the whole torso exposed and so forth. And pay attention to the patient's comfort level throughout the course of the treatment. If they're uncomfortably hot, uncomfortably cold, there's a lump in the bed or on the table or wherever you're working with them, just kind of help them to be as comfortable as possible, as well as moving forward with your treatment and paying attention to their reaction that happens. So protect them from falling. So depending on how you're moving around, burns, so you don't want to have too hot of water that you're using, chilling, so the other end of it, awkward positioning, try to keep them, again, pay attention to their comfort level. And you want to end them warm and dry. So you want to prevent sweating or chilling at the end of the treatment. Otherwise, as we talked about earlier, that can actually cancel out the benefits of the treatment if they end up being overly hot or particularly chilled at the end of the treatment. So when using a cold treatment, you want to make sure that you have a good reaction. If you don't have a good reaction, restore them to warmth, their baseline warmth. You can place them in a warm bed, in a warm room for half an hour to an hour. And then kind of that resets their core body temperature, and then re-prepare them for the cold treatment. If they don't have a reaction to the treatment, within a couple times, probably ought to just wait because you don't want to overdo it. So some observations to make as a person is nursed back to health. So whenever you're doing an assessment or an observation of various signs and symptoms, you want to be discreet about them so that the individual doesn't exaggerate the symptoms that they may have if they know that there's an assessment being taken. That can happen. So just kind of be discreet about it. Just be observant, use your powers of observation, and also note signs that are lacking. So there may be some symptoms and signs that would indicate a particular direction. If they're not, that particular direction of illness is going to be have a strike against it. So just pay attention for present and absent signs and symptoms. So some of those are the general appearance of the face and the skin. So if they're pale or if they're flushed, those are some things to observe. If there's a grimace on the face, for example, with pain in their expression, their various facial movements. So just pay attention to that. Their comments can also help you in the assessment, just as they're talking to you. Just be a listening ear and pay attention to what is being said and respond appropriately. So some symptoms can be brought out from other conditions. So don't jump to conclusions about what is going on based on presentation of symptoms, because there are conditional overlap of symptoms in many cases. So some core things to keep in mind as you're working with your patient. You want to look at just their basic elements of their skin. So itching, swelling, rash, discoloration, etc. Those types of things. Is it pale? Is it flushed? Those are some things to pay attention to. The mouth, the gums, are they pink and firm? How's the tongue? The voice, are there any changes in voice? So are they laryngitis or a deep husky voice that could be congestion? Those types of things. Appetite. Is there a loss of appetite? Generally, there isn't an increase in appetite with someone who isn't feeling well. Generally, it's a loss, but that can lead to weight loss. So taking a weight on a regular basis at about the same time is a good way to kind of establish a trend and a baseline for weight. And, in the traditional healthcare environment today, there is often a lack of attentiveness to a person's dietary needs while they're in the hospital. Sometimes there can be a delay in a surgical procedure and they want to have that done on an empty stomach. I understand that, so that there isn't interference with the medication that's used for anesthesia. But after that, if the person can't see well enough to order on the menu or is asleep when the menu comes in, they can miss mealtime. And that's where a patient advocate comes in really well. And, during the last little while, patient advocates have been not allowed, which is really a tragedy. And there have been many tragedies associated with that, just not having any familial oversight who can pay attention to the patient's needs and pay attention to what's going on around them. And that's really critical. So in a home environment, that's not necessarily as much of an issue. You don't have the shift changes taking place like you do in a traditional healthcare environment. You may have a well-versed, compassionate, caring, observant care provider, and then the shift changes and you come on with someone different. So that's something to pay attention to. Sleep, is that easy or difficult? What might be the difficulty? There's actually too much light in the room can actually disrupt sleep. And so can too much sound in a room. So if there are things that are disrupting the sleep, or even eating too late, anyway, just think about the different causes for sleep disruption, if that's an issue. And then general fatigue, what could be causing that general fatigue? So it could be something as dire as internal bleeding, where there's some anemia that are causing fatigue. So there could be a variety of different factors associated with that. So is there a fever? Is it present or absent? Is the skin moist or dry during the fever, cool or hot? Sometimes people with a fever will alternate between being chilled and being hot. I remember having illnesses as a kid where you'd be cold one minute and then the next minute you'd be sweating, kind of back and forth, back and forth. So the typical body temperature is 98.6 on the Fahrenheit scale. And so up and down from that is something that you should pay attention to. So temperature, if an individual states feeling unwell, you might want to take their temperature and get an idea if they're in the normal range, or if maybe there's something that's causing an increase in body temperature. So fever is the body's mechanism of action and reaction to pathogenic challenge. Many times a raise in body temperature will actually help to kill out. So you don't want to quench a fever immediately, but you want to pay attention to it so it doesn't get too high. So 1 to 2 times a day when they're well, just checking the trend of the temperature, just making a log of it so you can see if there's a change that occurs. If you don't have a log or a baseline, then you're not going to know what to look for. I mean, that's after all how they actually came up with 98.6 as being the normal body temperature. That's the trend where when healthy people have their body temperature taken, that's where it sits. And anything up or down from that is outside of baseline. So if there's a headache present, you might want to take the temperature as well. Sore throat, vomiting, chills, any abdominal pain, diarrhea, or skin rash could also be an indicator that a temperature would be a good thing to take. So any of the temperatures with the directly above symptoms, the sore throat, vomiting, chills, etc., should have some additional medical attention just to make sure that it's not something that is going to lead into something of a greater nature. So pulse and respiration rates, is it changed from the normal for that person? So different levels of fitness, for example, are going to have different baselines of normal. So someone with a good physiological tone, that is, they're in shape, 56 to 60 is going to be a baseline pulse rate. Someone who is not in shape is going to have a higher pulse rate. And you can check that on the carotid artery at the side of the neck with the 2 fingers. You don't want to use your thumb. I always use the 2 fingers because the thumb has its own pulse and it can interrupt or add counts to your pulse taking. So the number of counts in 1 minute or in 30 seconds times 2, the longer period of time you take it, the more accurate it's going to be. But if you even have just 15 seconds to get it and multiply by 4, just depends on the situation. But the shorter amount of time you take that temperature, the less accurate, precise it's going to be. But you can get an idea. So abdominal pain, you can use charcoal and water and rest a meal and see if that has that abdominal pain come to be abated because, it could just be something they ate. If it continues on in the abdominal region, you may need to get some medical attention. So appendicitis or something else may be coming on beyond what simple things can address immediately. Watch for nausea and vomiting. You want to note the color and amount of material, and that can give you an idea of maybe how long that's been happening. Bowel movements, frequency, color, and consistency. Urinary issues, pain would indicate a UTI, for example, and burning. An inability could be stones or something like that. Incontinence and too frequent of urination. That could also be an issue of something like diabetes, perhaps. And then blood in the urine is an important thing to note. There also could be blood in the bowel movement too, and that would be something to alert. So some basic hydrotherapy treatment materials to have an effective hydrotherapy treatment. Here are some things, kind of a list of things to have as tools to make your work efficient and effective. So blankets, and then old wool blankets that can be cut into usable sections. For me, I think this would be kind of hard for me to do, to cut up a wool blanket, because wool blankets are treasures in their own right, in my opinion. But having wool swatches of cloth that can be used for fomentations and things like that, that are going to hold heat in the place where they're applied. Hand towels, Turkish towels, basically just a high nap terry cloth towel. Sheets, old sheets that you can cut up into strips. Don't have a problem with cutting up sheets. Newspapers can be helpful for soaking up water or just covering an area. Hot water bottle, an ice bag. So that's basically a cloth bag that has a cap on it that you can put both warm and cold things into to apply to surfaces. You could do that with a hot water bottle too. You could put ice in it. A bathtub or some kind of high volume water container. A shower is optional, but could be beneficial depending on the therapy that's used. Pails, a wash tub. So these are going to be deep enough that, so a wash tub would be like for a sitz bath, or a deeper immersion of the limb, small basins, enema with the various tips available. And then, of course, the forms of water that you're going to be treating with. Ice, so that's ice, and then hot and cold water. So generally not using steam, but hot and cold water and ice. So you can get cold water fairly readily. You can make it extra cold with ice. Hot water, if you have a range, or even a campfire with a pot of water over it, you can get water boiling and do hot and cold treatments just about anywhere. So here's a pictorial representation of some of those things that we talked about from the pail perspective. There are, I believe in the picture above, there's like a 50-gallon pail up there too, and some 5-gallon ones. I think the scale maybe not completely equal between containers there, but then there's some ovalized galvanized wash tubs and deeper wash tubs that will be helpful for larger volumes of water, even if it's just having it handy nearby for further use. So to review this portion of preparing for and just the signs to pay attention to, you can review this at preparingforthetimeoftrouble.com and future and past parts of the series.